night shift work in particular poses a really significant long-term health risk. And that seems to become more pronounced the longer someone does night shifts.
What are the implications when we're looking at people who either are shift working, night workers, and the implications there around meal timing, and also people who maybe have a traditional working week but follow an intermittent fasting or restricted eating timeline? What are your thoughts on that? If we can tackle the shift workers first, because obviously there's a ton of research at the health outcomes of working non-traditional hours.
Yeah.
What do we know about the eating behaviors around those working patterns?
So shift work is night shift work in particular poses a really significant long-term health risk. And that seems to become more pronounced the longer someone does night shifts. And the reason is because we don't tend to just work consecutive night shifts. Most shift patterns follow a rotating pattern, which essentially means, I think for listeners, a good way to conceive of this is imagine constantly doing 7-hour flights, you know, east around the world and never actually arriving in a destination. So you're in a constant state of jet lag, essentially. We call it, there's this term social jet lag that's arising now, which could apply. But with shift work, you're basically never actually aligning and synchronizing with the particular pattern of waking and sleeping and eating that you're following. And as a result, there are so many different factors that likely add up to influence the health risk associated with night shift work. And eating is possibly only one of them. For example, sleep disruption and sleep curtailment is itself independently associated with adverse health outcomes. As it relates to the nutrition and diet side, more so, it's interesting because, again, you typically see that diet quality itself is lower during periods of night shift works. With our group, we published a paper a couple of years ago where we looked at the pattern of energy intake on NHS nurses working night shifts. And basically, although their total energy intake during the days they were working night shifts didn't actually change. What they did was we saw this redistribution of energy. So they were consuming the same total amount of energy for 3 days that they were working, but they were now starting to consume more of the proportion of that energy during their night shift. So we've got, and within that, then we know from research on shift workers that the quality of that tends to be a focus on, again, some of these more, palatable comfort foods, essentially, And when you look at some of the qualitative research that has looked at, shift workers, a real picture emerges that, one, working nights isn't enjoyable. No one enjoys it. Two, if they're working jobs like in healthcare, there's possibly a lot of stress involved. They're possibly dealing with distressing situations. They're on their feet a lot. And so the idea that they would say, oh, I'll have a salad at 2 a.m., that's just not human behavior. And I can understand this. I mean, I remember we did a study a couple of years ago, which went through the night. We were looking at a kind of a form of simulated jet lag. And I remember, 2 a.m. just eating this half of this entire Jamaican ginger cake in the nurses' quarters, because at that point I was just so knackered and everything else. So there's a real social component why there is eating during the night shift. There's a social component and a psychosocial component to why a lot of those foods are more comfort foods, which inherently are not necessarily quote unquote healthy. But like I said, it's very difficult to tell someone, oh, well, just have some Greek yogurt instead. The optimal thing to do for night shift is also the hardest thing to do. The optimal thing to do would be to try to maintain your meals according to your actual daytime normal intake, in as much as possible. Have a big meal, for example, at say 8 p.m. before, assuming a typical night shift, might be like 9 to 7 a.m., for example. So do have a big meal beforehand that could hopefully sustain, and then try to avoid too much energy intake during what would be, because internally it's nighttime to the body, even though you are awake and you are conscious that you're awake. But I appreciate that. And the reason I talked about the other factors first is because I appreciate how difficult that advice is. Um, so typically what I would say whenever I'm kind of asked the question about night shift work is, unfortunately, we don't really have any good research on what they should do. We've all the research saying what not to do. And we really, for such a ubiquitous part of our workforce, we're really underserving that community by not having quality research that might suggest here are some strategies you can do. So in the absence of that, I'm typically left filling in blanks by saying, if you're going to snack, just try not to over snack, and try to keep it maybe to a couple of like discrete points during the shift, rather than just constantly like grabbing a biscuit here, grabbing a biscuit there, and that kind of thing. So to try to maybe put some structure on it. But yeah, again, I appreciate that I'm not the one that has to, be awake at 3 a.m. in an A&E ward.
What about then when the shift ends? Because someone's probably just wants to hit the sack at that point, right? But you're probably quite hungry. If you've tried to maintain healthy snacking throughout that, what are the implications of perhaps then having a heavy meal, then immediately going to sleep? Are you encountering some of the same problems that we've talked about previously with eating a big meal before bedtime when you've worked a traditional working day?
Potentially not, because your internal rhythms are still largely aligned to the daytime. And actual meal composition could help here as well. So typically, I actually do recommend, generally, if I am, I've spoken to, shift workers and been asked this question a lot on kind of various podcasts, and my response would typically be, do have a breakfast when they get home from the shift, but make it slightly more kind of, protein, kind of, rich protein meal, slightly more protein, that, and kind of lower in carbohydrate, because they'll get, a bit of a satiating effect from that. But it also may actually kind of help to just not have that much of an impaired kind of blood glucose response to a meal. So, for example, coming home and having like a couple of poached eggs or something like that, and, like a slice of brown toast, and something light, protein rich, and then going to sleep. And then when they get up, let's say they sleep, and again, the sleep quality is typically not great, but let's say they get up then early afternoon, again, have another light meal in the middle of the day, but also go out and get some, go for like a walk and get some natural light exposure. Again, all of this is because they're trying to, the ideal scenario is you try and keep yourself on your kind of day social, day active time frame, such that when you then finish your run of night shifts, 2-3 night shifts in a row, for example, you're hopefully then able to adapt slightly better back to a day active routine. And that's, again, particularly important for shift workers that have kids or something like that. And, just those kind of typical variables then, or, people that want to maybe meet friends on a weekend and they don't want to be too goose. So where as much as possible, yeah, I do think it's a good idea to have a kind of protein rich breakfast when they get back, sleep, have another, have a meal when they get up, when they wake up, and then have another meal again. And in as much as possible, they're trying to keep their meal timing aligned to kind of the daytime, so to speak. And yeah, even then, if that means kind of a snack during the night, even, maybe a protein bar, like a grenade bar, something like that. But again, because it's at least something that resembles a chocolate bar, but may not quite be. So it's a really difficult one to come to, broad based advice for a part of the workforce that unfortunately is very underrepresented in research for what to do rather than just don't do.